Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. Here's a very simple card trick you can do anytime with a borrowed deck of cards. Have someone freely select a card, and it really doesn't matter which one they pick, and then they will look at that card and show it to their friends. And while they're showing that card to their friends, you're not looking at it, obviously, so that's the card. Then you tell them to put it between their hands to warm it up, and in just a moment I'll be able to tell which card is the warmest inside the deck. So what we're going to do now is let you place that card back in the deck anywhere, and it literally doesn't matter where they insert it. The card goes all the way in, and you say, I'm going to take this deck of cards behind my back for just a second, and then I'm going to reverse that card. Now I have reversed one card in the deck just by feel. I reversed the warm card, and let's see which card that I felt. Oh, it turns out it's the Four of Clubs, same card you picked. Now how do we do that? To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Hi, Kit Weathers again. I just received the July edition of the Journal of Endodontics, which is kind of disturbing since it is August at this point in time. But I don't know if you've ever read this magazine, but it's chock full of a lot of good information. There are something like 100 pages in this particular issue, and there are more than 24 articles. And I figured that probably the best bet would be for me to read each one of these and give you the latest updates that we find. And as I'm looking at the journal, I see that it says JOE on it. So I figured maybe if we had a character like one of the Crazy Talk people we had last week, we could look for somebody named Joe. Now I looked around and I found that there were a lot of different characters on the internet named Joe. Little Joe Cartwright, there's G.I. Joe, there's Joe Biden, he's a character. Quite a few Joes out there, but I thought that the G.I. Joe was the most appropriate. However, it turns out there's like probably dozens of different G.I. Joes. So what I did, I picked one that I like, and I took it into the Crazy Talk program, and I'm going to let Joe read a couple of these articles for you and give you some information. So we'll see how that works out. If you find a G.I. Joe character on the internet that you like better than the one I've selected, send it to me at my email address, kit.weathers@gmail.com. All right, let's see what G.I. Joe has to say.
I'm G.I. Joe, and I'd be proud to lead you guys into battle anytime, anywhere. Whoa, that sounded more like George C. Scott doing an impression of General George Patton.
I guess whoever we get to do this voice, maybe it should be my voice. So no matter which character we pick, I guess I'll do the voiceover. Okay, for this week's Root Tip, I would like to give you the highlights of the first 3 articles that appear in the Journal of Endodontics. And this is July's issue, 2009. The first article is called Anesthetic Efficacy of Supplemental Buccal and Lingual Infiltrations of Articaine and Lidocaine after an Inferior Alveolar Nerve Block in Patients with Irreversible Pulpitis. And what the authors concluded was, although supplemental buccal and lingual injections of 4% articaine or 2% lidocaine did increase the success rate of the inferior alveolar nerve block in patients with irreversible pulpitis, none of the techniques provided acceptable success rates. In other words, if you're counting on infiltration for anything beyond the bicuspids, you probably are not going to get good anesthetic. So you're probably going to have to stick to some type of block for the first, second, and third molars. The next article that we found very interesting was entitled Outcomes of Non-Surgical Retreatment and Endodontic Surgery, a Systematic Review. And what they did was compare the success rate with surgical versus non-surgical endodontics. And they found a very interesting thing. For the first 2 to 4 years, the non-surgical was not as good as the surgical outcome. Surgery got a 77.8 success rate, where non-surgical at the same time period only got 70%. However, this relationship was reversed with non-surgical showing a higher success rate of 83% compared with only 71% for endodontic surgery. Now, after that, they didn't have enough studies to compare it, but it would appear that the much higher success rate with non-surgical retreatment is what we probably should be doing. And the third and final article that we want to talk about for just a few minutes today is a retrospective study of endodontic treatment outcome between nickel titanium rotary and stainless steel hand filing techniques. What they found were two very interesting findings. This was Gary Chung and Christopher Liu that did this study. They found there was a higher incidence of procedural errors, 39% with hand files compared to 19% with rotary files. There was also a high rate of periapical healing for the rotary files, 77%, compared to 60% of the stainless steel files. The conclusion was because there was a higher incidence of procedural errors and a lower success rate for the initial root canal treatment of teeth prepared with stainless steel compared with nickel titanium instruments, it would appear that we're going to have a higher success rate, fewer problems, and certainly it's going to go faster if we use rotary nickel titanium. Very interesting study. Well, that's it for another Root Tip of the Week. I'm Dr. Kit Weathers, inviting you to join me at our very next Root Camp.